resources with you. Great, so now I am going to turn it over to our first presenter, which is Dr. Vinita Dubey. She will be providing a presentation and then taking about 20 minutes for question and answer. The questions you have already provided when you registered are the questions we will be presenting to her today. Again, if you have other questions that pop into your mind during the session today, please feel free to write them in the chat or send them to me by email after, and we will try to follow up and get your questions answered. Thank you and enjoy.
Great, thank you so much, and thanks for having me here. This is always a wonderful group to connect with, and you always have a real pulse on what's going on in our city. You very clearly made a significant impact already with vaccinations and will continue to do so. So let's get started. So let's talk about how, sorry, if you want to go to the beginning, please. Great. Okay, let's start with a land acknowledgement. So I acknowledge that this meeting is being hosted on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishwaabek, the Chippewa, and the Haudenosaunee and the Wendat peoples. Sorry, if you could just put it back. Yeah. And is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Tkaronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with multiple Mississaugas and Chippewa bands. Okay, and with that, let's get started. Thank you. Next slide and next slide. So, okay, so vaccines that make a difference. How do we know that they have made a difference in our own city so far and in our own province? These are graphs that are taken from Ontario.ca. So anyone can access to them. They are updated on an almost daily basis. And if you look at that first graph on the left, the orange line is the cases per 1 million people. So it's a rate of cases of COVID among unvaccinated. So that orange line is the unvaccinated, very high on the left. And if you look at the blue line, it's the cases among vaccinated, and it is much lower. And that difference between the top and the bottom line tells you how much more risk there is for someone who's unvaccinated compared to a vaccinated person. So remember, vaccines are meant to keep us out of hospital and dying from COVID. You can still get infected with the vaccines. That can still occur. It's nothing to be alarmed with, but the goal is to keep us from severe illness. And if you look at the middle graph, it shows, again, that the orange line is people who are unvaccinated and admitted to hospital, and the blue line is people who are vaccinated and admitted to hospital. And you can see that blue line is even lower than the graph on the left, which includes all infections. Now, if you go even further, looking at ICUs, look at that blue line on the bottom. It's almost touching zero. If you are vaccinated, the chances of you ending up in ICU because of COVID are so close to zero compared to if you're unvaccinated, it's that orange line. And so I think this is a really important message. On the Ontario.ca website, it will tell you right now in Ontario, the number of people who are in the ICU who are unvaccinated and who are vaccinated. And so that's good for you to know, because when people say vaccines don't work, this shows, yes, they work. They work in Ontario right now with the Delta variant. Next slide, please. So this is another graph showing how vaccines work. And the bar lines, the green ones, are the number of cases that we've had since the beginning of January. So we had the end of wave 2, we had wave 3 in the spring, and now we're seeing a start to wave 4. But if you look at the line, the blue line and the dotted purple line, those are vaccination rates in our city. And you can see that as we get, the purple line is fully vaccinated, 2 doses. As that number gets high, the cases of COVID started to fall. And so this is just another example of how vaccines make a difference. Next slide, please. So who still needs to be vaccinated? Well, there are still 200 to 300,000 people in our city who still need to be vaccinated. And you can see that they live in all parts of the city. And so something that we are doing is looking at the youth, 12 to 17-year-olds. That's the first table that shows certain neighborhoods by number. So it's not a rate. So in the Mount Olive Jamestown community, almost 1,000 youth who still need to be vaccinated. If you look in the middle column, these are among aged 25 to 49 years of age. So the top community is Willowdale East. 8,000 people, 25 to 49, still are not vaccinated. Those are still big numbers. And then if you move along to 65 plus, again, Willowdale East is coming up top because the number of people who are still unvaccinated. So this gives you a sense for areas, neighborhoods that we can put more effort, because the total number of people who still have to be vaccinated is high. Next slide, please. Now, we need the 2 doses for the best protection. We know that 2 doses works with the Delta variant. And so as of September the 16th, over 51,000 Toronto residents were overdue for the second dose. So what this means is someone got their first dose and their second dose was due 1 month later, and they still had not gotten their second dose. So we know that the hesitancy is different. They already got 1 dose. So for them to get their second dose, let's focus on those people. So one of the questions might be, if someone says they're vaccinated, to confirm, did you get your second dose? And if you didn't, please get it. And you can see in the chart on the right that a lot of the people who have not gotten their second dose are young adults, 18 to 29 years of age. Next slide, please. Now, what about third doses? Well, we're providing third doses right now for people who are very vulnerable, who have a weak immune system. So, for example, people who live in long-term care, people who are on chemotherapy, are on medications that give them a weak immune system. Those people are eligible for a third dose. The reason why we are giving them a third dose is because they have a weak immune system. When they got their first dose and their second dose, their levels of vaccination were not the way most healthy adults was. It was down here. And so they probably need 3 doses to get the best protection, whereas most of us, for our primary series, we need just 2 doses right now. So third doses, there is a way that people can refer to their healthcare provider to have a form completed so that they can get that third dose if they are eligible. Next slide, please. What about the return to school? Many of our children in the city have been out of school for at least 6 months before school restarted. And we have many protocols in place to keep schools safe beforehand. But because COVID is in the community, we can expect that there will be cases of COVID in the school. It does not mean that schools are not safe. Again, because students and staff are wearing masks, they're in their cohorts, they're washing their hands, they're doing their screening every day, that will help to prevent the spread of COVID in the school setting. But if someone at school tests positive, Toronto Public Health will notify the parents, the students, about what that parent, what that student needs to do. And so this is an infographic that is available on our website to help answer parents' questions about what they need to know if someone at school tests positive. Next slide, please. In order to support parents, we encourage parents to have a positive attitude about getting vaccinated. Share your personal positive experiences and stories of other parents. Maybe you are a parent, why you got vaccinated, because you want to protect your 6-year-old who can't get vaccinated, for example. Talk about the benefits of the vaccine. We know about COVID-19. We know COVID-19 can be severe, even in children. And so talk about what we know about the disease and encourage the whole family to go and get vaccinated. It's important to know that in the summer, the rule changed. So anyone who is born in 2009, they may not be 12 yet, but they're going to turn 12 this year, can go and get the vaccine right away. And it is definitely recommended. Anyone who's 12 and older, get the vaccine. Even 12-year-olds, if they're going to go and watch, say, a game that maybe one of their siblings is playing in a hockey arena or in a basketball stadium, they need to be vaccinated in Ontario's vaccine certification program. Next slide, please. So where can you get the vaccines? It has changed through the months, but some things are still the same. We have our mass clinics. There are 5 of them now in the city: Cloverdale Mall, Metro Toronto Convention Centre, Mitchell Field, Woodbine Mall, which is new, and Scarborough Town Centre. No appointment is needed. From Tuesday to Saturday, from 1 p.m. to 7 p.m., anyone can come to get the vaccine. They do not need an OHIP card. All they need is some form of ID, and it can be a passport from another country, any type of ID. The other common place to get the vaccine is through these mobile teams or pop-up clinics, and you've heard about them at the subway stops, at malls. Some are going to workplaces, and again, no OHIP card is required. And then, of course, there's also the pharmacies, some of which are still providing the vaccine. Next slide, please. Do we still have to wear a mask? The answer is yes. Right now, the 4th wave is starting. And we have seen in our own country, in other provinces, what happens when we don't keep a good eye on COVID. COVID spreads a lot, and it can put a real strain on our healthcare system, and we don't want that. So even if we're vaccinated, even if we're unvaccinated, while we're in the 4th wave, we will have to wear a mask, especially when we're indoors, avoid crowded places, keep a physical distance as much as we can, wash your hands, stay home when you're sick. We know that all of these things have worked and will continue to work. Vaccines are our best option, but we will still continue with these to prevent a very bad 4th wave. Next slide, please. This is our slide on questions. If people have questions, You might know this already, but this is certainly a slide that you could take a picture of and share so that the people you talk to, if they have questions, they can absolutely contact Toronto Public Health to have individual questions answered by us as well. Next slide, please. With that, it's the end of the presentation, and I will turn it back to you, Shahina.
Thank you so much for that helpful information and all the up-to-date stats and information. That was really helpful. So in case anyone's not aware, Dr. Vinita Dubey is the Associate Medical Officer of Health for Toronto Public Health. We still have her with us a little bit longer to answer some of your questions. So for those of you who did submit questions in advance of today's session, thank you very much. We're going to start with those questions. But again, we do encourage you to put your questions into the chat or send them by email later in case we can still support you to have them answered. So the first question that we have for you is about the booster shot. So does having a third dose or a booster make me any safer? How would the ambassadors address that question if they're asked?
Okay, so right now the booster dose is recommended for people who are very vulnerable, living in a long-term care home, being on chemotherapy or a very strong medication. Those people need extra protection, and yes, they should get the vaccine if they are eligible. The question that people may have is, does everyone need a third dose? And the answer right now is no. Actually, I've seen new data from Ontario that shows that our vaccines are doing a very good job protecting against the Delta variant, the 2 doses, and for the general population. But we will continue to monitor. And if down the line, in a month, 2 months, 6 months, a year, it shows that we need a booster dose, then there will be a recommendation for that.
One quick follow-up question to that. If a senior is eligible for their third dose, when would they expect to get contacted about it, to get it?
So they actually may not be contacted directly because it's a very specific eligibility. Right now, it's not all seniors. That may be the case down the line, but right now it's only a senior who, for example, is on a medication, a specific medication, or lives in a long-term care home. So I recommend that they check on the website or call their doctor to find out if they're eligible and how they can get the vaccine. They can also call Toronto Public Health.
Perfect, thank you. The next set of questions are regarding schools and vaccinations for children. So Pfizer has developed a vaccine for children between the ages of 5 and 11. What do you think will be the timelines for children under 12 years of age to begin getting vaccinated in Toronto? Will 2 doses be required? And will it be a needle or a nasal spray?
Okay, good questions. It will for sure be a needle for the COVID vaccine. But we have a lot of very good experience giving vaccines to children. It will be available maybe sometime in the fall, maybe by the end of the year. The vaccine could be licensed even by next month, but then we also have to have the vaccine. Remember in December last year, the vaccine was licensed, but we did not have a lot of vaccine available. This will be a special pediatric vaccine, and so we have to get it. Canada has to be able to get it sent from Pfizer. So, but today, Toronto Public Health and the City of Toronto sent a media release telling everyone we are planning. We are planning to be ready as soon as we have a vaccine that is licensed and is available. We will have clinics to be able to vaccinate our children.
Thank you. One quick follow-up to that question. Would the children's vaccines be administered in schools or would they happen at the same vaccination sites for everyone else?
I think you can expect they might happen in a lot of places because the goal will be to vaccinate. It's about 200,000 children in the easiest way possible. For 5 to 11-year-olds, we will need parent consent or a guardian consent. So the children can't be vaccinated in a school without consent. They may occur like what's happening right now. For example, a school clinic after school, right after school, where a parent could come and bring their child. But these are all pieces that we are planning for to make it easy for parents to get their children vaccinated.
Okay, thank you. The next set of questions is around vaccination passports. So another kind of new occurrence in the situation. So we've gotten some questions around, can you explain the proof of vaccination system and how it's going to be enforced? I'm actually going to put a link into the chat that is a ministry link that relates to the vaccination passports. But the question for you is, can you explain the proof of vaccination system and how it will be enforced?
Okay, so this is a provincial program, just to say. It's not just for Toronto. I'm sure you're aware of that. The proof is actually a vaccine receipt that if you got vaccinated in Ontario would have received, or can look it up online. If you were vaccinated outside of Ontario, in other parts of Canada, or even in other parts of the world, you can use that same receipt for this vaccine certification. You have to be able to show that it's your second dose. You can also, though, get your vaccine that you may have got elsewhere recognized and put into the provincial system, and we have a link for that on our Toronto Public Health website. So you have to show your vaccination receipt for the second dose and proof of ID. And it's for specific places where you go. For adults 18 and up, it's if you go for any sort of fitness type activity, if you are a spectator at an event. These are the common areas in which you need the passport. Right now, for the 12 to 17-year-olds, if they are our participants, so they are a swimmer, they don't need to show it. But if they are watching, they need to show it. So there are a lot of differences. The best thing I can say is to get people to go to the website to be clear where it is required.
Great, thank you. How do those who are vaccinated back home register themselves in Canada?
I will find the link and share it in the chat. It's a check market survey, like a Survey Monkey, that they fill in the information, and then they will get contacted by Toronto Public Health. If they live in Toronto, it's Toronto Public Health, to have it put into the system. Okay, great. So we've got some other general questions for you. The first one is about winter approaching and the need for the regular flu vaccine. So will there be any restrictions for people with one or both doses of the vaccine to receive the flu vaccine? So we would definitely still recommend the flu vaccine again this year for anyone. It's actually 6 months and older can get the flu vaccine. The reason for recommending it is because we want to, again, keep all of us out of hospital. We don't want to end up in a situation like Alberta, where they have run out of ICU beds, for example, and flu can make people very sick. So in terms of the vaccine will be available in pharmacies, in doctors' offices for the flu vaccine. And in terms of restrictions, right now, you have to wait 2 weeks from when you had a COVID vaccine before you get another vaccine. But they're looking at that. So maybe that might change in the future. You might not need to have time between vaccines. And other than that, no, there's no other restrictions. You should still be able to get the flu vaccine without an OHIP card as well.
Okay, great, thank you. How many people or percentage of people tested positive for the virus and the variant after receiving both doses of the vaccination? Are the symptoms reduced if you are double vaxxed?
So if you want to see the number of people who are fully vaccinated and get COVID, go to the ontario.ca website, or to see Toronto data, you can go to toronto.ca/COVID, and that number is posted. It says the number of cases unvaccinated, partially vaccinated, and vaccinated. So that information is readily available. If you are fully vaccinated and you get COVID, yes, you get a less severe illness. And we know that because the people who are in hospital are mostly unvaccinated. The people who are in ICU are mostly unvaccinated. I can tell you from the cases that I have investigated in my work, people who are fully vaccinated and have gotten COVID have had very mild symptoms, maybe just a runny nose, a stuffy nose, not feeling well, very mild symptoms.
Thank you. If someone had side effects from the first dose, can they have the second dose of vaccine?
Yes. So for the most part, even if you had side effects from the first dose, it's still safe for most people to get the second dose. In fact, I was just at a talk this morning that talked about even if you had a severe allergic type reaction after the first dose, many people were still safely given that second dose. Now, if you had a severe reaction after the first dose, you should have your doctor refer you to an allergist. The allergist can assess you, can sometimes give you the vaccine under observation so that you can get that full protection.
Thank you. Okay, so one of the ambassadors asked one common reason or complaint that has come up in their conversations with people in their neighborhood is that even with the vaccine, you can still transmit the virus to others and get it. So they ask, why should I bother getting vaccinated?
Okay, so that first graph that I showed you on the very first slide showed that if you are vaccinated, your chances of getting COVID are between 5 and 7 times lower compared to unvaccinated. So you're that much less likely to get COVID and to spread it to others. So there's no question that getting vaccinated helps to protect you, but also protect you from spreading it to others.
Okay. Related to that, some of the ambassadors have heard if we have to get booster shots, that means the vaccine isn't even working. How do we address this?
So that's not the case. The people right now who are getting booster shots are getting it because their own immune system was not strong enough to get a strong response to the first 2 doses. So we're providing them with extra protection. What we don't know, and we've said from the beginning, if our immunity might not last a year, we know it lasts for 6 months, 8 months, no problem. What about a year from now? Well, if our immunity wanes, we're not getting that protection against the severe illness, then you would get a booster shot. But it does not mean that the vaccine did not work. It just means that our immune system needs a boost to continue to have that strong protection that we need. Now remember, for some vaccines, like the flu vaccine, we get the vaccine every year. For other vaccines, like the measles vaccine, once you've had your 2 childhood vaccines, you are protected. It depends on the vaccine and on the disease.
Thank you. Okay, so some of the ambassadors are hearing from people that think that receiving many vaccinations may reduce or weaken our natural immune system in our body. So how do we explain to them that it's not true and that our body can sustain many vaccinations?
This is a very common question for people who are against vaccines in little children. And actually, if you actually look at the number of microbes and pathogens that a newborn baby has to respond to, it's much more compared to the antigens that are in a vaccine. And so I think that's the way to understand it. Our immune system can actually handle so many times more antigen than what is even in the vaccine. If you were to get COVID, you would have that much more infection compared to the vaccine. And so even if you need a third dose, by comparison is not even close to what it would be if you were to actually get COVID.
Okay, great. Just to add to that question, and you did already answer this, but once again, so some parents are arguing with ambassadors that their children are not really at risk, and therefore they do not need to be vaccinated against COVID-19 and risk the vaccine side effects. What would you say to parents who are nervous about vaccinations for their children and youth?
Yeah, I would reassure them. You can say that you understand why they have concerns for their children. There's no question that in the US, where COVID has not had as good control, many otherwise healthy children have gotten very, very sick from COVID. And we cannot predict which child is going to have a mild illness and which is going to get very sick. We've heard already about a death this fall from someone in Ontario, a child who died from COVID. So it can happen. We know, though, that the vaccine is safe, that the side effects are very minimal. The vaccine will protect the child, but it will also protect the child from spreading COVID to others. And especially in homes where there may be multi-generations, like grandparents living in that home, that added protection can actually be really important.
Thank you so much for that. We really appreciate you being with us today and providing all of this incredible information. Thank you very much, Dr. Dubey.
Yeah, it's my pleasure. Thank you for having me. Have a good rest of your meeting and always happy to connect with you. Keep doing the wonderful work that you are doing. And thank you to our interpreters as well.
Thank you. So I am now going to move us into the next part of our presentation by Charles Zhu. He is a community ambassador, and he also plays multiple roles in the community. I am going to make sure that Charles's presentation is accessible. And I'm sorry to those whose questions we were not able to get to yet. Apologies for that.
Thank you, Shahina. Am I ready to go?
Yes, thank you.
Great. Thanks for Dr. Vinita Dubey for your amazing information. And I've attended many of your town hall meetings myself, and it's always informative and helpful for me to gain up-to-date information and knowledge about the COVID-19. Now, I want to extend a warm welcome to all my fellow amazing ambassadors here. And thanks for coming, because this training is meant for all of us to share our tips and the challenges together. I compliment you for all your hard work and for your love and passion and be part of the solution to this pandemic. We all want this pandemic to end. Even anti-vaxxers want this. I want to express my genuine appreciation to Shahina of Social Planning Toronto for her support of our ambassadors. I worked with Shahina as a grant advisory committee member last year. I shared with her on multiple occasions the impacts that the community ambassadors are making and the challenges we are facing on the daily basis. It touched her heart. I shared with her it would be great to create a peer-to-peer support network for community ambassadors to support each other, not necessarily in the form of success stories, because sometimes it's hard to resonate. Rather challenges or even failures, as I know that our job is not easy. Sometimes lonely, not very well appreciated, as some of you have shared during the survey, and I appreciate all your responses. I worked closely with many ambassadors from the community. We supported many pop-up clinics together, including the largest community-supported vaccination clinic on May 16th. We administered over 10,000 doses in less than 24 hours. We also do door-to-door outreach, support the mobile testing, vaccination clinic. So work is becoming increasingly hard and challenging as we run into many resistances, microaggression, and even hostility, such as verbal abuse, intimidation. But I know how important it is to continue this campaign until the majority of the eligible residents in our community got vaccinated, so we can stay safe and our children can stay safe. Next slide, please. Make all those who are getting vaccinated, as well as those who have already been vaccinated, into our allies. I call this make everyone an ambassador strategy. I use this approach extensively, especially during the pop-up clinics and the mobile clinic outreach. Do not immediately walk away when you find someone who is telling you that they are already fully vaccinated, but spending time to talk to them, listening to their concerns, such as the current vaccination policy, the Delta variants, or even, sorry. Sorry, I'm losing the location of my speaking notes. Just give me a second. Spending time listening to their concerns, such as the current vaccination policies, the Delta variants, or even more so, the importance of encouraging others to get vaccinated. Remember that it's in their best interest of everyone to get vaccinated, especially those who are our close contacts. Their vaccination is important to our safety, as well as their own safety. I have many examples in this regard, but I will give you an example from a very recent door-to-door outreach. I talked to a lady who is already fully vaccinated in the US, and she is very thankful to our work and willing to help us. She told me that she has a young child, and I did two things. First, I invited her to join our parenting group. Second, I enlisted her as a helper to distribute our mobile clinic flyers in her building. Next slide, please. You are all heroes. We didn't come into this role to make money. As some of you have written to me, that honorarium is small. Many of us spend hours and hours at the vaccination clinic, yet we are not compensated properly. You are here to make a contribution to end this pandemic. So don't beat yourself up for your perceived failures. As a matter of fact, don't consider that as a failure at all, even if you made a mistake. It's definitely not your fault that you have received all the negative feedback, microaggression, or even abusive behavior. At this stage of the vaccination rollout, we are still working on mobile clinic and door-to-door outreach, even though the number is not as impressive as before, but the work is even harder. We are not giving up. Every shot counts. Be encouraging to each other and cheering each other up for every little success we have made. So far, we have made great progress. As Dr. Vinita Dubey earlier shared, September data has shown to be better than anticipated, many attributed to the improved vaccination rate. And do not take it personal. This is the toughest of all, as all of us have run into situations, especially among our close friends, colleagues, relatives, and neighbors who are skeptical of getting vaccinated. But you need to remember, it's not your fault that they didn't, or don't feel defeated simply because you failed to convince them. The truth is, for some of them, nobody can really convince them. Next slide, please. It's been 6 months since our vaccination rollout campaign officially started. It's almost felt like repetitive in what we say in our outreach journey, but it doesn't have to be that way. Even when we are doing door-to-door outreach, we can focus on things which are common by showing a genuine interest to them as a person. Remember, you are not a salesperson. You are not there to sell a product. For example, asking questions such as, how is COVID-19 impacting your life? How is your family? Are your kids going to in-person school or virtual school? How are they coping? These are great in helping others to open up to you. Connecting with your own talent, interest. For example, one ambassador from my parenting group is an artist. So she always shares ideas on how to use arts creatively to reach out to people. We are also using our parenting group blog site to pass information out. I created my parenting group to support our children's education. Ever since the pandemic got started, I noticed how many families and children are suffering. I made the conscious decision of switching my focus to support the fight against COVID. I used my parenting group as a platform to support the vaccination campaign. We have six ambassadors in my parenting group, and we share all kinds of information to help members as well as their friends to get the information. It became a wonderful information center. Many people sent their questions about the testing or vaccination clinic schedules, locations, and got instant answers. I also proactively provide feedback of our members' concerns to East Toronto Health Partner through my role as a co-chair in the Community Advisory Council. For example, the very recent decision of closing up the testing centers made many residents worried in the midst of the fourth wave. I communicated to the ETHP and they made the decision to open up 2 outreach centers to make sure we have the adequate testing capabilities in our community. Next slide, please. We also know there are real cases of complications due to the rare case of side effects, or sometimes simply raw causation. Saying it in plain English, it is really triggered by something else, but attributed to vaccine, simply because it's easier that way. In this situation, try to use the empathy skill that you learned through the BEworks training that most of us went through. During these times, data is of little or no use. No matter how much you want to cite amazing statistics, that those are rare cases, it doesn't work. The reason is that we are dealing with human emotions and the fears and anxieties. Even though statistically, you know the vast majority of people don't have severe side effects. As long as there is one case, as long as that something happened to someone, they know it's extremely difficult. In that case, offer your support by genuinely care about their feelings, their fears, sometimes even their angers. This is where empathy comes into play. Just simply imagine someone you love run into the same situation. How would you feel? That will help us a lot. Also, another important thing is to keep confidentiality at all costs. No matter how tempting that you want to share, such as getting COVID-19, it's very personal. When people share with you, try to keep it confidential for them because you need to have a long-term strategy. Next slide, please. With this pandemic, lots of information keeps changing. Even our public health guidelines have changed or evolved over time. Just remember, this pandemic is unprecedented. We are learning as we go. For example, Ministry of Education, as well as provincial government policy, have initially not made the favorable decision to support our vaccination campaign. As many ambassadors know, this automatically translated into canceled vaccination appointments. For vaccinations passport, I even asked this during one of Dr. Vinita Dubey's ambassador town hall meetings. At the time,
Charles?
the province, yes.
Charles, I'm sorry, it's one of the interpreters. I'm sorry, I didn't get the example about the Ministry of Education and the provincial government. Can you say that again?
Sure. Ministry of Education, as well as the provincial government policy, have initially not made the favorable decision to support our vaccination campaign. As many ambassadors know, this automatically translated into canceled vaccination appointments. For vaccination passport, for example, I even asked this during one of Dr. Vinita Dubey's ambassadors town hall meeting. At that time, the province has not made a decision on this. Even though Quebec or some other countries have adopted this, I passed out the vaccination passport petition on change.org to all the networks I'm in. I also relied on many people, remember my Make Everyone an Ambassador strategy, to pass the petition out. with a massive support, currently over 156,000 signatures. The rest is history. We have TGSB and other school boards, many universities and colleges, private sector businesses require staff to be fully vaccinated. These changes become favorable to our vaccination campaign and increase the vaccination rate. I often use this new development as topics in my outreach as well. Very effective. Next slide. So I want to share, this is a question and answer session. One of the things is about the potential barriers. Language is one of the very important barriers, as many of you know. And I myself speak Mandarin fluently and speak English very well. I also know some French. And but you always run into a community, especially the community I live in, have over 40 languages people, residents speak. So you're not going to be able to cover everything, no matter how talented you think your language skill are. You're going to be able to run into people who don't speak your language. So how you do that? One of the example I ran into in the most recent mobile clinic is, I asked the lady, she's from, she speaks Turkish. I said, do you have a friend who might be able to call to help you to translate? So she called that friend while I'm standing at the door, talk to her. And this kind of strategy we can work on. I think that conclude my presentation.
Thank you so much for that, Charles. I really appreciate it. We have time for one question for you. You touched on this a little bit in your presentation, but can you share some more tips and challenges, especially around rejection and misinformation?
Yeah, I think I shared a little bit. And so when it comes to rejection, I like every other ambassadors, which I shared with you, Shahina, already. I run the parenting group. One of the things which I often identify with people is failures you have. Not those amazing articles you shared, how you did an amazing job as parents. And the same thing here as ambassadors. Some of the things we resonate the most is not how amazing they did, because those are maybe one of the cases specific to their situation, because you don't want to make yourself feel you are not as good as other ambassadors. I know all the amazing ambassadors, and I know all of them work very hard. Rejection is normal. Sometimes, as a matter of fact, in some of the rejection cases I have received, especially when people told me somebody they know had a severe side effect, as a result they don't want to have, or even somebody says they know someone died from it. And these extremely rare cases, it happens. As I shared earlier, you're not going to be able to refute that because it happens to them. It's real. And so what I usually do is offer my sympathies towards them and say I'm very sorry. But if you need any support, remember we are not experts sometimes. Dr. Vinita Dubey is an expert. Even her, sometimes she may not have all the answers. So what I say is, if you are ready, if you have more questions, I can introduce you to someone which I know and to be able to help you. And those are the kind of strategies we know we can use. And especially if you don't think you are in a position to be able to answer the question on the spot, or you are not able to do that, and use this kind of strategy, may be able to diffuse the situation, because we don't want to get ourselves into a heated debate or arguments with anyone, especially when they are mourning the loss of somebody they love, or the situation has been so difficult and challenging. Thank you.
Thank you so much for that, Charles. We really appreciate your presentation and your great tips. Thank you.
Thank you.
I am now going to pass it over to our third presenter, Dr. Ada Lei. Ada, I am going to try to spotlight. Oh, there you are. Perfect. Thank you, Gloria and Sharon. Wonderful. So a quick introduction to Dr. Ada Lay. She holds a PhD in cognitive neuroscience from the University of Toronto. She is currently the vice president of BEworks, the world's leading behavioral change firm. You may have already received a training with BEworks at the start of your work as a community ambassador. We're very happy to have Ada with us here today.
Thank you. I'm going to try to share my screen. So let's see here. Okay, everybody can see this okay? Yep, okay, I'll take silence as confirmation. Perfect, so that's me. I'm Ada. And perhaps many of you know, or if you don't, at BEworks, since the pandemic hit, we've formed Canada's foremost COVID-19 behavioral think tank. So we've done a lot of work over the last over a year now on things ranging from how to promote vaccine uptake to healthcare worker support to public health campaigns. And as Shahina mentioned, we've done a lot of work with the City of Toronto Ambassador Program. So many of you may have attended one of our workshops. We built the Ambassador Handbook on how to have productive conversations with community members so that we can increase their vaccine confidence. Now, we've learned a lot over the last year and a half on how to deal with COVID-19 and pandemic and vaccinations. And what we learned, in a nutshell, is that before engaging with people about the importance of receiving the vaccine, we need to first and foremost understand why people are hesitant. Now, there are a lot of reasons why people may not be fully willing to get the vaccine. And some reasons are easier to address than others. Some of the easier barriers that people may face are operational based, right? So we talked about language barriers. We talked about transportation issues, perhaps. Some people may have technological barriers, so they don't have a cell phone or internet or laptop. And I say this is easier not to dismiss that these aren't problems, but that these are barriers where information works. If you provide people with the right access, with the right tools, those can be overcome. Some of the harder barriers include individual health risks, right? Questions and uncertainty about whether the vaccine will interact with their medication or with their specific medical condition. And then there are religious and cultural considerations also. So for example, if the vaccine is allowed during Ramadan or if it includes pork products. Some of the hardest barriers to address are psychological. How people think, how people feel, how they perceive the world, what they value, and are they open to new evidence? And I say this is hard because it really is not as simple as providing information. A lot of times providing more information can actually backfire in those situations. So some of the psychological factors we need to think about when we try to influence people's confidence in the vaccine are that people can just, it's a feeling, right? It's a feeling that it's too risky. It's a feeling that the science doesn't feel right. It's a feeling that vaccines aren't natural. It's a feeling that they don't care to understand. They may feel just generally uneasy. They can't quite pinpoint why. And trust in itself is a feeling, right? And so, and that is why, because it is more emotion-based, sometimes providing more information will not necessarily ease their feelings. And to simply put, it is because we don't all see the world in the same way, and we don't all value the same things. Now, another important factor to remember is that the vaccination rates right now are relatively good. This graph I pulled a week ago, so it might already be outdated. But as of last week, we're looking at around 70% of the entire Canadian population, they have their vaccines, right? Now, if we try to map that back to older data that we collected on people's intention to get the vaccine, we can easily see that the people who said that they will get the vaccine, they probably already have the vaccine now. So crudely speaking, we are likely dealing with people who are on the fence or who are opposed to the vaccine. So conversations that you will have going forward will become even more difficult than they have ever been. So, things are trickier now than they were ever before, right? So you may be dealing with people's emotions, people's anxieties. They may feel upset, they may feel hurt, they may be unwilling to talk to you, and they may have a high level of intolerance to people telling them how to think. They may have a lot of concerns, whether valid or not, right? They may have sensitivities to risk, concerns about the science. They may have distrust for institutions. And of course, there's a level of misinformation that you may be dealing with. So in a nutshell, conversations will be difficult. So how do you go about encouraging people to vaccinate? The number one rule is to take a step back, connect first, and then change second, right? Connect first and then change. Basically, fundamentally, it's about making human connections while speaking naturally and authentically. And I think Charles touched upon this, right? You don't need to sound like a public health expert. There are those experts. You don't have to be that person. As an ambassador, as a human, as a friend, as a neighbor, as a family member, it's about you as a human connecting with them as a human. And that is your first way in to making change in the way that they think. So fundamental to human connection is this notion of empathy. And there are four key dimensions to empathy. First is we need to take their perspective. And secondly, do not judge. Third, acknowledge their emotions. And fourth, be explicit in communicating all of that. And I'll explain each of these in a little bit more detail. But on being judgment-free, we need to remember that feelings are not right and they're not wrong, they just are. So people don't want to feel like they're alone in their feelings. And you can, when you speak to the person's feelings without judgment, that's the way to establish rapport and connection. So to build trust with the person, we need to be open to understanding their situation wherever they are in life. And the biggest thing to remember, as illustrated by this iceberg diagram, is that you will never be fully aware of all the things happening in their life or in their history that influences how they came to their current circumstances or their current behavior. So really, that is the number one thing to remember, is to do not judge. Now, there are 4 key tips on how to have productive conversations. And there's immense power in first allowing someone to feel heard and validated. The first step is to elicit people's perspective, get them talking so that you can understand their motivations and their values. Secondly, allow space for their perspective, right? Truly come from a place where you are listening to them. And really what we know is that if people feel like they've been listened to, they will in turn at some point listen to you. And the fourth tip is to establish common ground. Believe it or not, even if you have immediate differences in opinion, there are still a lot of the same values that you guys will hold together that is the same. And that will go a long way in building trust. So examples on how to elicit people's perspectives. Number one is to get them talking. Ask open-ended questions, right? So for example, would you mind sharing what your concerns are with getting vaccinated? What do you think are the potential advantages to vaccination? Once they start talking, encourage perspective sharing. So you can say something like, I'm aware that we both have different perspectives about the vaccine. would you like to connect and share some thoughts with me, and I'll share some thoughts with you. Giving people space to share is then really, really important. You've opened up the door for them to talk, and now is the place for you to validate their perspective. You don't have to agree with what they're saying. You just have to say, I have empathy for you. I understand where you're coming from. You can choose to normalize their feelings by saying it's normal to feel this way. You can confirm their words. You can summarize what they've said. You can say something like, what I heard you said is XYZ. Did I get that right? So again, you don't have to agree with them, but you can confirm that you understand and that you can validate that their feelings are correct and that they're okay. Thirdly, listening to them. I've seen a lot of questions come up about acknowledging community and community history and context. And this is very important. If they are sharing that, it's coming from a place of them sharing with you their vulnerability. So you should at minimum acknowledge that you understand their concerns, summarize what you've heard, and that you can say something like, we are in a unique situation today where due to the impact of the pandemic on Black, whatever community it is, we are prioritized for the vaccine. The important thing is that you acknowledge and you can confirm their concerns. And of course, be mindful of your tone. So be very patient, be calm, avoid making jokes, because that can come off as dismissive, and don't get too personal. Do not ever direct attacks at an individual's lifestyle, integrity, or intelligence. Now, on establishing common ground, there are a lot of common values that we share as human beings, right? We all value freedom. Many of us value family, and we all value safety for ourselves. Now, of course, with freedom, with vaccination concerns, many of us want to get the vaccine now because we want to have the freedom. For them, it's getting the vaccines means hindering their freedom, but nevertheless, it suggests that our common value is freedom. As long as you can find that common ground, you can build from there. So you can say something like, you and I both value freedom, but in different ways. I understand that you want freedom to choose, whereas myself and many people I know want the freedom to live our life normally again. I'm curious to know how you feel about returning life to normal again. And again, ending with an open question so that you can continue the conversation. And lastly, if you feel that you're really not making any further headway to be able to share information with them, it's okay to acknowledge that and say, I hear you saying no, and that's totally okay. And then leave the door open. Say, I appreciate your time and sharing your concerns with me. You can contact me at any point if you want additional information or support. This way you can facilitate continuing the dialogue at some point later in time. So I will end with this note, which is that it's important to kind of look at the bigger picture, right? The end goal isn't necessarily to convince everybody right away, and you certainly should not expect to be able to do that. It's about slowly inching everybody closer and closer to vaccine confidence. And every single conversation that you have with community members, with your friends, with your family, every single action that you take in the role that you have is contributing to the cause. And I personally thank you for your efforts. And that's it for my talk. And I'd love to hear any questions that you may have.
Thank you so much, Dr. Lei. We really appreciate all of that helpful information. Thank you. We do have some follow-up questions for you as well. So the first one is, what is the best approach to get information about whether someone is vaccinated or not?
That's a really great question. The best approach that we found is to keep the question very neutral and general. So you may ask, how do you feel about vaccinations? What's your perspective on them? without making any sort of statements ahead of time. So avoid saying things like, have you gotten your vaccine yet? Very direct questions like that you may want to avoid because it can come across as confrontational. So keep the question general and open up kind of the conversations that way. Those who have already been vaccinated will be very forthcoming and they will say, I'm vaccinated, or I've booked already, it's coming, very excited. And those who might be a little bit hesitant or opposed, asking a general question will already elicit some sort of response that will tell you if they're on the fence or if they're opposed. And that's usually the best way to go.
Thank you. Thank you so much for that. There was a great comment in the chat there as well. You can start with, what do you need? Do you need information about the vaccine passport? So that's a really smart way of kind of starting that conversation.
Absolutely. Yep. That's another really great way, is to offer information that's not directly related to the issue of vaccinations, but that is very topical and very neutral.
Great. The next question is how to deal with safety, rejection, as well as microaggressions during outreach.
Right. So the first thing when you're in the moment would be to try your best to maintain a calm, a very calm and stable composure. You definitely do not want to respond in a similarly emotional way, because that is not constructive, and it typically will not go anywhere or end well. And the basic thing is, if someone is responding to you in an emotional way, you can just say, oh, acknowledge their perspective. Thank you for sharing. Use the same techniques, validate their feelings, normalize their feelings, and confirm that you understand, where they're coming from. And if you find that they continue to be very aggressive in what they're saying to you, it is okay to try to end the conversation. You don't have to continue it, right? You can say, thank you so much. Feel free to say that I'm starting to feel a little bit uncomfortable, or that you're getting very upset. Let's continue the conversation at a later point in time. Now, my biggest concern is how you will feel, right, after having such interaction, and the impact on how you you may feel stressed, you may feel anxious, you may ruminate over what has transpired. And I would say that there's the number one thing to remember there is that there are a lot of things in this world where you can control, and there are things where you cannot. How someone responds, how someone behaves, a lot of times is out of your control. And what you can control is how you respond and how you behave. And, if you feel, as long as you know that you've done all you could to change their perspective, then you've done a good job, right? And in some of our earlier training, we've offered training for ambassadors on resilience. And I believe it's recorded, so you may be able to access that. But we have a lot of tips and techniques that we could share on how to protect yourself from aggressive conversations, and how that may how you can de-stress yourself.
Great, thank you so much for that. I'm going to ask you one last question that relates to a comment that was also in the chat. So there was a comment from someone expressing concern about religious figures, I guess, being not very connected to Toronto Public Health as part of the strategy. I'm trying to find it. Oh, it's difficult to send, oh, sorry. I'm trying to find the person's comment here, and of course cannot locate it now. Oh, here, I am very concerned that there's little to no input from authoritative faith representation to Toronto Public Health. So there was actually one question that said, how do we connect with people who are saying that my religion allows me to be exempt from getting the vaccine? How would you respond to that?
Right. You know, I would go back to the same tips that that we walked through on productive conversations. I think that, you know, at minimum, you should acknowledge that they are probably right in their own individual experience, and that you understand where they're coming from. I do not know that the ambassadors need to have a response right away on whether it's right or it's wrong. I think it's fair to say, you know, I can direct you to resources on religious exemptions, and provide you with some more information on this matter.
Okay, I'm going to give 2 minutes to the person with their hand up before we do our wrap up in our contest.
Yeah.
Thank you very much. I have so many questions, but I'm just going to focus on the last one, please. With regards to the religious exemption, I think we really need to get the correct information from authorities, so that both Toronto Public Health as well as the ambassadors can actually be aware of what's the religious position on religious exemption for the vaccine. So without going into any specific faith, you can imagine if you are the authority in a faith belief, and a congregant comes to ask you for a religious exemption, and you have the authority to refuse, because there is no backing or there's nothing from Toronto Public Health, for example. The congregant says, well, my employer asked me to get a faith exemption, and it seems as if employers are telling their employees you can get a faith exemption to not take the vaccine. So it's very, very confusing. And I believe if ambassadors are with the information that people are not supposed to ask for religious exemption, that's going to help us a long way, because Friday it was very aggressive and I had to deal with it. Fortunately, I know how to deal with it. I'm just worried for my colleagues and their safety. Thank you very much.
Thank you for sharing that. If I can just say, that is a really important consideration. I would really encourage, if you do have time, to stay at 3 o'clock for a few extra minutes just to share more information. I mean, this is something that could be incorporated into a future discussion session, or maybe we can bring the right stakeholders to the table to have a bigger strategy about it. Oh, sorry, so I'm just going to...
I thought I asked them to say.
Sorry, I think we have someone else trying to ask a question. If I could just ask you to wait until 3 o'clock, just so we can let others go if they did need to leave at 3 at the end of this part of the session. It would be great for all of you to stay at 3 if you don't mind, to share all your questions and ideas for future segments. But I did want to say a very special thank you to Ada for your presentation and for the answers that you provided to the questions. Thank you so much for that. We're just going to run a really quick poll. If you don't mind just participating in one last quick poll to let us know about your experience. So sorry, I'm just trying to look for it. Here it is. It will just take about a minute. There's 3 questions for us to just see if you felt that you got the information that you came to the session today for. So we'll just let that be up on the screen for a couple of minutes. And just wanting to say thank you again to all of our presenters, to all of you for being here today and participating. And we really hope to see you at all of the future sessions. But please do stay behind at 3 o'clock to 3:30 if you are able to, so you can share more of your questions and give us more ideas for future topics for discussions, future training sessions. We really do want to hear from you and make sure that we're creating spaces that you feel are important and that you feel are beneficial for your vaccine outreach work. We'll give it about 1 more minute. And please, if you do have further comments or feedback for us, please feel free to send them to us by email. I shared my email address, and if Charles would like to do the same, you can please feel free to contact either of us and give us further feedback. We'll give it about 10 more seconds, but please feel free to put your hand up or just say something if you need more time. We'll give it a few more seconds. I can see a few more people filling it out. Okay, great. I'm going to bring the poll to a close unless someone shouts out that they're not done yet. Okay, thank you so much to all of you who filled it out. And you can see on the screen what the results of the poll were. Great. So it looks like almost everyone got so much out of today's session in terms of tips and information and strategies. And data and statistics. So that's really great to see. So again, feel free to share more feedback with us after the session if you'd like to. But yes, we do have a contest for 2 grocery gift cards, but I just came up on a little bit of an issue. So we usually use the wheel of names to do our contest. But the report for who participated in today's session is not ready yet. Until I end the Zoom meeting, it won't let me access all of your names. So what I'm going to do is right after the session ends at 3:30, I will use this Wheel of Names app and put all your names in it, and we will choose the 2 winners of the 2 grocery gift cards, and we will email you to let you know if you won. So thank you again to all of you for being here. Charles and I really hope that it was beneficial for you, and we would really love to invite you to stay if you would like to for the next half an hour and just informally share with us any more ideas that you might have. And very special thank you to all of you who did fill out that survey before the session and shared your ideas there. Thank you. And thank you again to all of you for all your hard work. Best wishes for your vaccine outreach work, and hope to see you soon. Okay, so Charles, would you like to lead us into the next part of the session?
Sure. And again, thanks everyone for coming. And I shared a little bit about the rationale why we started this, what I call is really a peer-to-peer ambassadors network. And as you realize, this is not about just a few training sessions. The non-amount of training sessions are going to be enough for us to be able to deal with all the situation, the circumstances that we are running into on the daily basis in the field, at the vaccination clinic, at the pop-up clinic, at the testing clinic, and wherever we are. But more so, I shared with Shahina, right? And when I run the parenting group, as I earlier shared briefly earlier, parenting is hard. People run into lots of difficult circumstances and lots of challenges. As a matter of fact, dealing with temper tantrum and dealing with challenges in school, dealing with all kind of issues. And when you run into an article, show them how one person successfully done something, people feel remotely connected. I'm not saying those are not valuable. Some of the articles are really valuable too. But one of the topic which I learned through the parenting is something called, it's run by Early On. You guys as parents may heard about it early on. And they have something called the Nobody's Perfect program. And I want to run something similar here to be able to identify with each other and resonate with each other, especially those challenges and difficult circumstances that we run into, knowing when going outside the field and working in the clinics and doing all those kind of things, not easy, but it's not just for you. It's actually for all the ambassadors as well. And I want to get the sense from every one of us how we can help each other, support each other, by resonate with each other, by sharing with each other challenges, doesn't alienate us or doesn't make us feel belittled. It's even more so, it's empower us, saying we are not alone, but how we can work together, you know, to support each other. So when I shared with Shahina about all these things, she really took the opportunity and to affirm and says, you know, let's do that. And I really appreciate it because you know, after you guys signed up, Shahina sent out a survey, and then lots of you responded. And that's very really warms my heart, because when you share with each other in that level, and that's more important. I was hoping that we can form a sort of informal peer-to-peer support network, because on the ongoing basis, as you guys are aware, the challenges are going to even more. So I'm going to stop here. I think I will let you guys, if you guys have anything at all want to share from your heart, from your burning desire, from whatever challenges you've run into, and you can share with us, you know, what's happened during the situation, and you don't even need to provide an answer, because sometimes we don't have an answer. And so just share and feel free, and I just open the floor to all of you. Do you feel okay, Shahina, what I shared? Sweet.
That was wonderfully said. Thank you, Charles. And I also wanted to add that I've just created a Jamboard, and I put the link into the chat. So if anyone's interested in clicking on that, it might take you away from the Zoom screen, but you can come back to it. But you can feel free to write your ideas in the Jamboard. You can type your ideas in the chat if you feel comfortable, or say them out loud, and I can type them in the Jamboard for you. So let us know how best for you to participate. But there are little sticky notes that you can use to write your ideas. So if you're on the Jamboard now or not, on the left-hand side, there's a little icon in the middle called a sticky note. So when you click on it, you can just write, you know, type your idea in it. And I can help to organize those. So yeah, feel free to just shout out your ideas, type them in the chat, put them right in the Jamboard. It's for you.
I don't like to put people on the spot, because I know I also belong to the local champion network, and there are quite a few people from local champion network, which is from Center for Connected Communities. You guys are here to, if you guys have any questions to share. And I also see there's ambassadors from my parenting group are here. And if you guys want to share, Kathleen, you are here. Are you comfortable to share some of your tips through this, so we can break the ice?
Hi, Charles. Kathleen here. Sorry, I was just about to write that I have to go to pick up my kids from school, but I definitely feel comfortable to speak about some of the challenges. I'm running low on time though. Sometimes I have, like, especially when I'm talking to close friends and family, I've run into more, it feels like more of an obstacle, because it tends to get a little more personal in the conversation. So that's been one of my biggest challenges, to like be able to continue a good conversation, keep rapport, not offend anyone, like just be really respectful. And like sometimes people get offended and maybe don't want to talk to you again. And then personally, like I've had to mend it and continue the conversation. And luckily I'm still on good terms and we're still chatting. So I don't know if this is helpful for anybody else who, you know, especially when you're talking to friends and family, sometimes it can get a little bit more intense.
Definitely. Thank you very much, Kathleen, for sharing. Kathleen is also, yeah, go ahead. Who's talking? Sophia.
Okay.
Sophia.
Thank you, Charles, for giving me a chance to talk about it. At the beginning, when the vaccination started, it was everyone was scared and they were not ready to take it. So just like we experienced hard time to convince them that this is beneficial and you can take it. It will be good for you, your family, and you will be safe. So I want to share one thing that uh, just like I had another group. So there was a peer leader and she was personally, she was not ready to take the vaccine. She was by herself was a peer leader and she said, no, my mind is not ready to take it. What I can do? So it one of the meetings, she shared this one. And I told her that you are right. If what are you thinking, it is right. So let's I will suggest you that to go to your doctor, family doctor, and ask your family doctor that what can I do? I have this type of feelings that I am not ready. So she did the same. She went to the family doctor and family doctor told her that you can take the vaccine. It is safe and it is good for your health also. So, you know, she shared her picture when she was vaccinated and her husband was with her and same time both of them, they took the vaccination. And then she was connected herself with the hospital and her community got many people got the vaccinated because of her. And she shared that on that I am arranging for my community that they should take the vaccination. So at the beginning, it was very difficult. So just like myself, I was also one of the frontline community ambassadors. So I took the vaccine and I share my picture in my own Thorncliffe Wellness Cafe group and the other groups, and I shared that one that I am vaccinated. Then we also did a lot of workshops in their own languages. They had a lot of questions. So we answered that one. We also invited public health people to facilitate in their own language. So they when they satisfied themselves, then they shared their pictures also. Sophia, we got vaccinated. So at the beginning it was difficult, then after that everyone was okay. And because of our outreach, 1,000 people got vaccinated. Thank you so much.
Thank you so much for sharing. And obviously, all the community ambassadors made lots of amazing contributions, including yourself. I really appreciate it because I worked alongside with you guys like a lot. Now, next in line is E-Man. Your hands up, please.
Yeah, thank you very much. I would like to say that the ambassador peer support is an excellent idea. However, I think peer support is extremely important in many circles. One of the things I'd like to highlight perhaps is we need to consider starting it with a foundation to ensure that we have proper coverage before we actually extend an invitation to everyone to join. And I'm only saying that because it's better to have a structure than get everyone on board rather than getting everyone on board and then trying to put together a structure. I believe so that when you have peer support, you can direct concerns or situations to the resources that we've already set up. So it becomes easier, putting the horse ahead of the cart rather than the cart ahead of the horse, only so that you can get maximum benefit and output from the peer support that you're thinking of implementing? Thank you.
Thank you very much for your sharing, Iman, and we'll definitely take that into consideration. Earlier, is there any other questions?
Or ideas?
Or ideas? Or just simply want to share an experience? Anything's good.
So I also really like the idea of peer support. In this way, we can, feel that maybe if you are experiencing something, like we are not alone, because that the questions comes up related to religious. I have been in that situation too, but I try to acknowledge that person and I say, yeah, and it's very, very important and helpful if we can get together and share those ideas, because in this way we can support the community more and also help each other more by sharing those ideas. So I definitely like that idea and I wanted to share that, and thank you so much for holding a space. Thanks.
Thank you. And who's speaking? I didn't catch.
It's Negin.
Nagin? Okay.
Yes.
Thank you so much, Nagin. Kashmila, your hands up. Could you share? And after is deep day.
Yes, hi,
Hi.
this is Kashmira, and thank you very much. It's very informative today. And now when we started to do the outreach, the first we find that people when we go to the low income housing or any those community housing, they literally tear the flyers in front of us and they say they don't want information. They don't want you to take a vaccination. Just get out of us. They slam the door. So the same day we had a table and we had a flyer, and on that time it's 3 or 4 weeks back, and we say that, oh, we are giving information about the vaccine passport. They just came and took the flyer. After that, people was keep coming and getting the flyers. The same evening we went, we changed the flyer, we print out a bunch of new flyer, put it into the front page, that vaccine passport information. So from that, when we was talking to them, they told, vaccine passport is coming up, how to get it, how to apply for that. And people was shopping from that who did not take a vaccine. You can figure it out by talking that they are just getting. And then we have the another information about the pop-up clinic today, tomorrow, after that, what's going on. And we was keep passing and we was leading them to the vaccine clinic. So from that, less aggressive, they was listening and they are willing to take information because that's something that new coming up. So this is the way, if some more support, like if you wanted to travel to TTC, you have to have a vaccination information that informs the people, and that's how we can get more people to get vaccinated. We can reach to our target to the 90%. The second thing, I was going through the outreach and we find out like pop-up clinic, when the pop-up clinic was outside the church. So when the people go in and come back, we just giving them the flyer, giving the information. We were sitting down there and I said, it's not working well. We are missing somebody. So I went to the management of the church, spoke to the pastor and asked them that, can you please announce after your prayer that there is a pop-up clinic and vaccine passport information are given. Can you just go after? So they agreed to it and pastor announced it. After announce, right, 3 people came to take their first dose to the pop-up clinic. And then I asked if you can announce all your after your prayer. So they say next, it's after 2 hours. Again, I went to the church, spoke to them, they announced it. So I learned that this strategy is working. After that, we started to go to the area church, ask them, even the Jamaat Khanas, temple, mosque, And we are right now just approaching everyone that after every prayer, if they announce and we gave them the information close to their area where is a pop-up clinic, or where they go and get information, or they can contact us. And I guess that's working better than one-on-one and knocking the door, and less abusive word, less abusive behavior. I think that the people are welcoming these ideas. They are open to take information. That's what I wanted to share. Maybe I'm wrong, but just I'm sharing what I felt.
Thank you so much. It's not wrong at all. And I want to encourage you. I think whatever you have been working on, whatever works, and even if just simply a one-off situation, you need to we need to pat ourselves on our back, because not lots of people are doing that for us. And I think I always out there in the field and encouraging people. As a matter of fact, I shared with Shahina the most recent mobile clinic. We outreached 8 buildings, and the day of the mobile clinic, we did 4 hours. We have people from the Mark Gallen Hospital. We had a bus over there. We also have people from emergency response and all the other things. We had 4 hours. We reached out to many people who are not vaccinated, but we only managed able to get 7 vaccinated. Do I feel disappointed at the time? Yes, I did. But I'm honest with you guys. You will feel that way, even though I say you shouldn't feel that way. But the truth is, we do feel, sometimes we do feel there's a kind of effort we put into, we are expecting some kind of amazing result. And the time of 10,000 doses, more than 10,000 doses are not there anymore. It's not the time. And as a matter of fact, if you look at the curve of anything, at the end of the curve, that's called the tail curve of the distribution. Is usually very difficult to accomplish. So I actually want to praise you and all the ambassadors here for all the amazing work. It doesn't matter how little you think or how not so significant. I would think everything we are doing is significant. Every dose count, and I really mean it. 1 dose at a time. That's what we are doing, and we didn't get to this far without any one of your contributions. So thank you very much for sharing, Karishimi.
Can I interject? Kashimi, I didn't hear the first thing. The audio was going in and out. There's construction work here at my house. I couldn't hear the first part of what you said. Were you saying that you need more resources to allow you to do things like take the bus as part of your outreach?
No, I'm sorry, but no, I don't mean that they allowed me, but the House city made a decision that now the vaccine passport is coming up, and that really helps the people to get vaccination, because they know that now wherever you go, you have to show your ID. So we need to, ultimately they forced to take a vaccine. The same way that when you ride a TTC bus, and if there is some policy comes like that, oh, you have to show your ID, and then people are more ready to take a vaccine, right? Because we work on to the 80% where we push as much as we can. Still we are doing, but the other resources are coming that helps more. Like the people wasn't taking a flyer, and the one word vaccine passport is coming up, and people was ready to take information. Whoever did not take a vaccine, they was coming to take. Like I have my own friend, she's RPN working in a hospital. Every 48 hours they test, COVID test, but she doesn't want it to take a vaccine. And she was really upset, and all the time we have a long conversation. Why? Oh, I don't trust. I trust. Whatever happened to me, it happens to me. Why are you concerned? If I die. And then I said, no, it's not you die, you die. In the beginning of the pandemic, I lost my husband, and I know how hard it is. The same time, I see that my next door neighbor, who is 65-year-old, and he had a tenant of 82-year-old. 82-year-old got COVID. He passed it to the landlord. Both was in ICU. And 82-year-old survived, but the 65-year-old passed away. He lost his life. Who is responsible? Whose fault it is? Are we at the point looking at the fault of each other, or are working together and beat it and restore our original life? Choice is yours. We cannot force you. Choice are yours, but I want you to make a wise choice. And ultimately, if you choose to harm the public or to your family, it's your choice. And then we end up the conversation, and it's ongoing. Now they force that at workplace you have to have a vaccinated. So they will take it because they don't want it to lose the job. So the same way, if the more forces comes that you wanted to travel by TTC, you have to show your ID. Yes, whoever regular base traveling, they will take a vaccine. That's what I mean. I don't mean that we need power, but city has a power, and they can put it into power. And we can work under cities' rules and regulation to achieve our target of 90%.
Thank you so much for sharing that. Thank you.
You're welcome.
Next hands up is Nagin.
Yes, it's me again. So thank you so much, Kashmira, for sharing your experience. And I'm so sorry to hear that like you lost your husband. Sorry for your loss. So I would like to share that I know we are focusing on vaccine hesitant mainly, but during my experience, you know, when I was doing outreach, I have got some questions about how we can take care of self after vaccination, like how we can protect ourselves now when we got vaccinated. And I have seen people are not using masks in the correct way, which is so important, and public health is suggesting that still we need to, you know, keep washing our hands and using masks. I want to just ask that what are, you know, the strategies that we can provide some information for people that they need that information about how we can protect ourselves and society now after getting vaccinated, because we have some population are vaccinated and they need that information too. So I want to ask that, is there any strategy that we are working on, or is that in the table, or is that anything that we are planning for that or no? Thanks. Don is speaking.
I just want to get it clear from your question. You are concerned about after you get vaccinated, you are concerned about running into people who are not properly following public health guidelines, such as using masks.
Well, yeah, it's not my concern though. It's like people concern, and they ask that questions, you know, how we can just take care of self after vaccination. Do we need to still follow those policies because now we are vaccinated? I have seen some, you know, unclarity around that certain topic. So I want to know that, are we having any plan to share this information with people as an ambassador, like how it just works? Because this is also part of that experience that I have during my outreach.
Yeah, question like this, I ran into myself as well. But I think according to Dr. Vinita Dubey earlier during her presentation, she also mentioned that we still need to adhere all the guidelines. Now, in terms of what kind of strategy we can form, because you know there's a protest out there. There's people refuse to wear masks, all those kind of things. I actually, correct me if I'm wrong, as ambassadors, I don't feel it's actually our it's in our power to be able to make any mandate or stuff like that. Public, because as far as my understanding goes, Toronto Public Health already have that in place, and I don't think it's ever been removed. Shahina, correct me if I'm wrong. And so I think this kind of things, it's basically being in place, and there are always a group of people who are not following the advices, and to the point that some of them are doing demonstrations. I actually heard there's some parents are demonstrating in schools, and which I think which is very concerning. And some anti-vaxxers also try to do demonstration in hospitals, stuff like that, which I think some of the jurisdictions says that you're not allowed to do that. And I'm not quite sure in terms of our province whether we made that a special case or not, because some of these we need to continue follow up. That's why a peer-to-peer support network will be helpful. We can share useful information with each other. We just need to come up with a platform like how we can go forward doing this. Yeah. Thank you though, Nagin.
Yeah, thank you so much.
Actually, I just wanted to add a quick point. I saw yesterday on the news as well that people not wearing masks were created a big scene at the Eaton Center downtown, and they pushed their way into a store. And I guess some of them pushed police officers and got arrested, and they weren't wearing masks. So it's very contentious. And I would say just make sure you're aware of your own safety when you're in certain situations like that. But I will definitely pass this question over to the City of Toronto, because you're right, it's a gray area, but I think it would be good for the city to provide a response as well. Nagin, for your question.
Yeah, sure. It's this question, it is really in my mind, and I see that it's very important. So I have been asked these questions many times. So it's a concern that, okay, so I will be in touch with you. Thank you so much.
Thank you.
I think now it's 3:30. Do you want to continue, or should we just stop here?
I can stay on a little bit longer. I know that our ASL interpreters may have to leave.
Yeah.
But I'm happy to stay on another 15 minutes.
I think actually, as a matter of fact, I don't see any more hands up, but maybe it's a perfect place we can stop, because as I shared in the past and with Shahina as well, the idea is not just through this workshops or seminars. We are going to have a continued conversation through surveys, emails, communications. So. Is that okay, Shahina? Shall we?
Yes, thank you so much, Charles, for all your hard work and efforts in designing the training session alongside with us at SPT, and to everyone, all of you, for all your hard work and efforts. It is such difficult work, and I have such admiration for all of you. Keep up the amazing work, but be safe. And thank you for coming today, and we look forward to seeing you at the next sessions.
Thank you, Shahina, and thank you, everyone. Every one of you, you are the heroes in my book. Thank you for your hard work.
If any one of you would be interested in being a speaker at one of the upcoming trainings or learning circles, please send us an email to let us know if you'd be interested in being a speaker and what you feel you could speak about. That would really help us as well. Some of the sessions will have a community ambassador speaker. So it would be great to know if you're interested in that role. And thank you again to Gloria and Sharon for your interpretation support today. Thank you so much. You've been so wonderful to work with. Thank you for coming. Stay in touch.
Thank you, Sharon and Gloria. Thanks, everyone.
Bye.
Bye.
Shahina, just on behalf of the interpreters, thank you so much for sending all the materials. I think Sharon and I felt very well prepared. So thank you for that. That was great.
Thank you again.
Have a great afternoon. See ya.
Bye.